An ear infection, also known as otitis media, is an inflammation or infection of the middle ear. The middle ear is the space behind the eardrum that contains tiny bones that vibrate in response to sound waves and transmit sound to the inner ear. The middle ear is also connected to the back of the throat by the eustachian tube, which helps to equalize the pressure on either side of the eardrum. When the eustachian tube becomes blocked or does not function properly, fluid can accumulate in the middle ear, providing a breeding ground for bacteria or viruses to grow and cause an infection. Ear infections can be acute, short-term, or chronic, long-term, and can affect one or both ears. Ear infections are common in children, especially those between the ages of 6 months and 2 years. According to the American Academy of Pediatrics, up to 83% of children will have at least one ear infection by the time they are 3 years old. Boys tend to have more ear infections than girls, and children who attend daycare or have siblings who attend daycare are also at a higher risk of getting ear infections. Adults can also get ear infections, but they are less common than in children. Adults with a weakened immune system, allergies, or structural problems in their ears or nose may be more prone to ear infections. Why children are more susceptible to ear infections than adults? There are several reasons why children are more susceptible to ear infections than adults. Eustachian tubes in children are shorter and more horizontal than in adults, which makes it easier for bacteria or viruses to travel from the nose and throat to the middle ear. Children's immune systems are still developing, which makes them more vulnerable to infections. Children are more likely to get colds or respiratory infections, which can lead to inflammation and swelling of the eustachian tube and increase the risk of developing an ear infection. Children may have difficulty communicating their symptoms, which can delay diagnosis and treatment of an ear infection. It's important for parents to be aware of the signs and symptoms of ear infections in children and seek medical attention if they suspect their child has an ear infection. Causes of ear infections. 1. The role of bacteria and viruses in causing ear infections. Ear infections can be caused by both bacteria and viruses. When a child has a cold or respiratory infection, the germs can travel up the eustachian tube and infect the middle ear. Bacteria can also infect the middle ear directly through a perforation, hole, in the eardrum. Some of the most common bacteria that cause ear infections include Streptococcus pneumoniae, Haemophilus influenzae, and Moxella catarrhalis. Viral infections that can lead to ear infections include the flu, respiratory syncytial virus, RSV, and adenovirus. 2. The anatomy of the ear and how it can contribute to infections. The middle ear is separated from the outer ear by the eardrum, which is a thin membrane that vibrates in response to sound waves. The middle ear contains 3 tiny bones called the malleus, incus, and stapes, which transmit sound from the eardrum to the inner ear. The middle ear is also connected to the back of the throat by the eustachian tube, which helps to equalize the pressure on either side of the eardrum. When the eustachian tube becomes blocked or does not function properly, fluid can accumulate in the middle ear, providing a breeding ground for bacteria or viruses to grow and cause an infection. In addition, children with structural abnormalities in their ear anatomy, such as a cleft palate or Down syndrome, may be more prone to ear infections. Factors that can increase a child's risk of developing an ear infection. There are several factors that can increase a child's risk of developing an ear infection, including age. Children between the ages of 6 months and 2 years are most susceptible to ear infections. Family history. Children with a family history of ear infections are more likely to develop them themselves. Allergies. Children with allergies or asthma may be more prone to ear infections. Exposure to secondhand smoke. Children who are exposed to secondhand smoke are more likely to get ear infections. Attendance at daycare. Children who attend daycare are more likely to develop ear infections, possibly due to exposure to more germs. Bottle feeding. Children who are bottle-fed may be more prone to ear infections than those who are breastfed, possibly due to differences in the way milk is swallowed and the way the eustachian tube works. It's important for parents to be aware of these risk factors and take steps to reduce their child's risk of developing an ear infection, such as avoiding exposure to secondhand smoke and ensuring their child receives all recommended vaccinations. Difficulty hearing or responding to sounds. Ear infections can affect a child's ability to hear or respond to sounds, especially if there is fluid buildup in the middle ear. Children may seem to be ignoring or not responding to sounds, or they may have difficulty hearing soft or distant sounds. Fever. A fever is a common symptom of ear infections, especially if the infection is caused by bacteria. Children with ear infections may have a temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher. Drainage from the ears. If an ear infection causes a hole in the eardrum, fluid or pus may drain from the ear. This can be a sign that the infection has ruptured the eardrum and may require medical treatment. Irritability or fussiness in young children. Young children with ear infections may seem more irritable or fussy than usual. They may cry more often or have difficulty sleeping. Trouble sleeping or lying down. Ear infections can make it difficult for children to sleep or lie down comfortably, especially if they are experiencing pain or pressure in their ears. It's important to note that not all children with ear infections will have all of these symptoms. Some children may only have mild symptoms, while others may have more severe symptoms. If you suspect your child has an ear infection, it's important to seek medical attention to determine the cause and appropriate treatment. Using over-the-counter pain relievers such as acetaminophen or ibuprofen. Over-the-counter pain relievers like acetaminophen, Tylenol, or ibuprofen, Advil, Motrin, can help relieve pain and reduce fever associated with ear infections. However, it's important to follow the recommended dosages based on the child's age and weight, and to consult a healthcare provider if the child has any underlying medical conditions or is taking other medications. Applying warm compresses to the affected ear. A warm compress can help relieve pain and reduce inflammation in the affected ear. You can soak a washcloth in warm water, wring it out, and place it on the child's ear for a few minutes at a time. Make sure the compress is not too hot, and avoid using it if there is any drainage from the ear. Ensuring that the child gets plenty of rest and fluids. Rest and hydration are important for helping the body fight off infections. Encourage your child to rest and drink plenty of fluids, such as water, broth, or electrolyte drinks like Pediatrix. Avoiding exposure to secondhand smoke. Exposure to secondhand smoke can increase a child's risk of ear infections and make symptoms worse. Make sure to keep your home smoke-free and avoid exposing your child to smoke in other environments. It's important to note that while these home treatments can help relieve symptoms, they do not cure the underlying infection. If your child's symptoms persist or worsen, or if you notice any signs of complications such as hearing loss or drainage from the ear, it's important to seek medical attention from a healthcare provider. Medical treatments for ear infections. Antibiotics for bacterial infections. If the child is over 6 months old and the infection is severe, antibiotics are medications that can help kill the bacteria causing the ear infection. They are typically only prescribed if the child is over 6 months old and has a severe bacterial infection. The type of antibiotic and duration of treatment will depend on the severity and type of infection. It's important to follow the prescribed dosages and complete the entire course of antibiotics to ensure the infection is fully treated. Antiviral medications for viral infections. Ear infections caused by viruses cannot be treated with antibiotics. However, antiviral medications may be prescribed if the infection is caused by a specific virus, such as influenza or herpes simplex virus. Myringotomy, a surgical procedure to drain fluid from the ear. Myringotomy is a surgical procedure in which a small incision is made in the eardrum to drain fluid from the middle ear. This procedure may be recommended if the child has recurrent ear infections, fluid buildup in the middle ear that is not clearing on its own, or if the infection has spread to other parts of the ear. The procedure is typically performed under general anesthesia and the child may need to wear earplugs or ear molds to prevent water from entering the ear during bathing or swimming. Tubes in the ears, also known as tympanostomy tubes. Tympanostomy tubes are small, plastic or metal tubes that are inserted into the eardrum to help drain fluid from the middle ear and prevent recurrent ear infections. This procedure is typically performed under general anesthesia and involves making a small incision in the eardrum to insert the tube. The tube may fall out on its own after several months, or it may need to be removed by a healthcare provider. It's important to note that medical treatments for ear infections should be recommended by a healthcare provider based on the type and severity of the infection, as well as the child's age and overall health. Treatment options may vary depending on individual circumstances, and it's important to follow the healthcare provider's instructions and recommendations for the best outcome. In conclusion, ear infections are a common condition in children that can cause pain, difficulty hearing, and other uncomfortable symptoms. They are typically caused by bacterial or viral infections and can be more common in children due to their anatomy and other factors such as allergies and exposure to secondhand smoke. However, most ear infections can be successfully treated with home remedies such as pain relievers and warm compresses, or medical interventions such as antibiotics or myringotomy. It's important for parents to monitor their child's symptoms and seek medical attention if they are severe or do not improve within a few days. Parents should also take steps to prevent ear infections by avoiding exposure to secondhand smoke and addressing any underlying conditions that may increase their child's risk. Ultimately, with proper treatment and care, most children with ear infections can recover fully and go on to enjoy a healthy, happy childhood.